Talking About the Smokes is a collaborative project led by a very large group of experienced Aboriginal, Torres Strait Islander and non-Aboriginal people. Before this project, we knew that the national prevalence of daily smoking in the Aboriginal and Torres Strait Islander population was falling, as Tom showed, but of course not fast enough. And at 42% was still 2.5 times that of other Australians. And we also knew that it was estimated to cause 1 in 5 Aboriginal and Torres Strait Islander deaths and 1/6 of the health gap. But we didn't know what parts of our tobacco control effort was working or how these different parts were working and what was not working. It was not clear if Aboriginal and Torres Strait Islander smoking and quitting was similar or different than other populations, and whether established tobacco control interventions worked similarly or differently. Different people had took different positions on whether we should or shouldn't generalise from the large body of research in other populations. And there was very little evidence to help us decide whose assertion was correct. Maybe I should steal my thunder a bit and say, by the end of the project, we think that things are pretty similar, which of course has enormous policy implications. Talking About the Smokes is closely based on the ITC project, or the International Tobacco Control Policy Evaluation project, that both Frank and Mel mentioned yesterday in their presentations. In this, we were greatly assisted by Ron Borland, who was not only a member of our research team, but has been a chief investigator on many ITC projects. The longitudinal design of ITC projects in 22 countries around the world and comparisons between those countries enables researchers to assess the impact of national tobacco control policy interventions that are most likely to make the largest impacts on smoking prevalence. In contrast, randomised controlled trials, which are often thought to be the gold standard in research design, are largely restricted to individual cessation interventions or small-scale local community interventions, which are less likely to have huge population impact. Unlike the phone surveys used in most other ITC projects, we work together with Aboriginal community-controlled health services to employ local people to conduct face-to-face interviews of a nationally representative sample of 2,500 Aboriginal and Torres Strait Islander people in 35 locations. We then came back a year later, resurveying 49% of the smokers and recent quitters from the baseline survey. But as we're still analysing those follow-up results, I'm going to concentrate on the baseline results today. Talking About the Smokes is a truly national project, as you can see from the map. The project has worked with 34 Aboriginal community-controlled health services and the Torres Shire Council up in the Torres Strait, with sites in every state and every territory, in capital cities, country towns and remote areas. These sites were selected to reflect the mix of where Aboriginal and Torres Strait Islander people live today. This means, we think, that the results should be relevant to the work of anyone, anywhere in the country. Of course, Tom mentioned some differences in different parts of the country. We did find worse outcomes by different measures of disadvantage, education, employment and the like, not just remoteness. But these were not always consistent across all outcomes. Aboriginal and Torres Strait Islander people, Aboriginal community-controlled health services, the National Aboriginal Community-Controlled Health Organisation, NACCHO, and all its state and territory affiliates have been involved in all stages of this project, from the very conception of the idea to developing it into a research project plan, to collecting the local data, to training and supporting local people, overseeing the project, interpreting the results and telling people about the results. Each participating health service signed an agreement with the project about all elements of the project. They received funding from the project to employ a local person to do the interviews, and funds towards their expenses, and funds for vouchers to compensate community members for their time when they were telling us their stories and answering our surveys. Nearly 100 people were funded to collect the surveys around the country. This close involvement throughout the project has not only meant that we've asked the right questions, that we've conducted the research appropriately so that participants felt confident to answer questions meaningfully, it has also facilitated the translation of the results into improved policies and practices in these same Aboriginal organisations. A detailed description of the baseline results were published as 15 papers in an MJA Medical Journal of Australia supplement on the 1st of June this year. And the Health Minister, Susan Lee, launched that supplement at Parliament House, and here she is with me, I'm the bald guy in the middle, and Lisa Briggs, who's the CEO of NACCHO at the launch. The supplement and all the 15 papers are open access and publicly available on the MJA website. We think it's the most detailed national picture ever of Aboriginal and Torres Strait Islander smoking and quitting. And the other thing to say is we also have a 4-page policy and practice brief. It's also important to let people know that before the launch on the 1st of June, we'd already fed back local results to each of the local Aboriginal health services, which many of those health services have used to reflect on their practice. We had already discussed the preliminary national results with participating health services at a forum in Sydney last year. We also shared the preliminary results with the government as part of their review of the Tackling Indigenous Smoking program that Tom alluded to. And since the launch, NACCHO has sent out a copy of the supplement and the policy brief to every one of its member organisations. Today, I'm just going to concentrate on the key messages from the baseline surveys. The papers provide all the prevalence estimates, the odds ratios, the confidence intervals and the p-values, and also include the comparisons with data from the ITC Australia surveys. And it's important to note that all the questions in our surveys and in the comparison surveys, comparison ITC Australia surveys, are on the ITC website and are publicly available at www.itcproject.org. The papers also discuss in detail the strengths and limitations of our research. Whilst I've said already that I think it's probably the best of evidence we've got available, it's not perfect evidence and it's not the last word. It is a nationally representative sample, but it's not a random sample. We use quota sampling. It is based on self-report. The associations are cross-sectional, so we should be careful about inferring causation. But of course, we're now doing the longitudinal analyses, looking at associations between responses at baseline with subsequent quit attempts and successful quitting at follow-up. The first lesson from our results is that we can all advise Aboriginal and Torres Strait Islander smokers to quit with confidence that our tobacco control message will be understood and welcomed. Like all Australian smokers, Aboriginal smokers already want to quit and know about the harmful effects of smoking. We found that similarly to all Australian daily smokers, high proportions of Aboriginal and Torres Strait Islander smokers want to quit, report knowing about the most harmful health effects of smoking, and wish they had never ever started. But we found that fewer Aboriginal and Torres Strait Islander smokers agree that there are social norms disapproving of smoking. So whilst 79% of Australian daily smokers agreed with the statement that society disapproves of smoking, only 61% of Aboriginal and Torres Strait Islander daily smokers agreed that mainstream society disapproves of smoking, and even less, only 40% agree that community leaders and elders where they live disapprove of smoking. The next message is that Aboriginal smokers are already trying to quit, but are having some trouble staying quit. We found that similarly to all Australian smokers, about half of daily smokers have tried to make a quit attempt, have actually made a quit attempt in the past year, but that fewer have managed to stay quit for at least a month on any quit attempt. And we also found that smokers are trying to protect non-smokers and kids from the harms of secondhand smoke. So we found, similarly to all Australian smokers, about half of daily smokers live in a smoke-free home. Next message is that health staff are doing a pretty good job in regularly advising smokers to quit. We found that more of the Aboriginal and Torres Strait Islander smokers recalled being advised to quit by a health professional in the past year than of the similar sample of all Australian smokers, 75% versus 56%. But that fewer of the Aboriginal and Torres Strait Islander smokers had ever used stop smoking medicines, whether that's NRT or varenicline, 23% versus 42% in the past year, even though the Aboriginal and Torres Strait Islander smokers we talked to were just as likely to think that these medicines helped smokers to quit. The next message is that dedicated tobacco control resources or staff at your local Aboriginal health service help. We found that if your local health service had either dedicated tobacco control funds from any source, not just the Tackling Indigenous Smoking program, or dedicated tobacco control staff, then more smokers had made a quit attempt, recalled being advised to quit, and had used stop smoking medicines. A final message is that I think our results so far suggest that reducing Aboriginal and Torres Strait Islander smoking is both possible and achievable. We found that many of the different elements of a comprehensive approach to tobacco control, whether that's brief intervention, smoke-free homes, ads, pack warnings, were associated with smokers wanting to quit, having made quit attempts and having sustained quit attempts. So remember from Mel's talk yesterday, plain packs and the increased warning label size were mandated in December 2013. That was partway through our baseline survey. And in our baseline results, we found that 89% of Aboriginal and Torres Strait Islander smokers noticed seeing a warning label said they noticed seeing a warning label in the last month. Now, we found no difference between those we surveyed before and after plain packs on that noticing warning labels, but Mel also talked about some of the micro indicators, and we did look at those as well. So after plain packs came in, smokers were more likely to say that noticing warning labels had led them to forego a cigarette, and more likely to believe that warning labels made them more likely to quit. So probably plain packs and the increased warning label size have made warning labels more effective, but we have to be a little bit careful of this evidence because it's just before and after, and the allocation to those groups was not random. I think our results support continued investment in the evolution of the Tackling Indigenous Smoking program, which funds the local and Aboriginal and Torres Strait Islander specific campaigns that Tom talked about, but together with mainstream tobacco control activities, which funds the advertising campaigns, the pack warnings, the plain packaging and the smoke-free regulation. Also supports activities that are already incorporated into routine health care, brief advice and individual cessation support. I also think that our results should bust any remaining myth. Anyone who still believes the myth that nothing is working in Aboriginal tobacco control. That pessimism that nothing is working can fuel the social acceptability and inevitability of smoking within Aboriginal and Torres Strait Islander communities, prolonging the epidemic and the suffering. And it can also lead to either inertia or moving away from well-tried tobacco control interventions that have worked so well in other settings to newer and more uncertain approaches. And while I think we should continue to research new tobacco control technologies, whether they're social media or e-cigarettes, this should not divert all our attention from understanding how to do established tobacco control activities better in high prevalence populations and in new and changing contexts. Talking about the smokes, we think has now provided research evidence that these established tobacco control activities have the potential, with some respectful tweaking and modification, which we can talk a little bit about tomorrow morning, to reduce the smoking prevalence and the suffering and preventable deaths that smoking causes in so many Aboriginal and Torres Strait Islander communities. I'd like to acknowledge the many people who were chosen by their local health service to ask the questions in the baseline survey, and note that many of them also did it in the follow-up survey. Also to thank the managers and staff of the participating health services, and finally to again acknowledge the members of our research leadership group, the project staff, our funder, the Australian Government Department of Health, and most importantly, all the participants for sharing their stories.